So when did you know you wanted to be a plastic surgeon?
I think in medical school. I went to medical school in Cincinnati after graduating from Chapel Hill in North Carolina, where I met my wife. And the plastic surgeons, you do rotations in medical school to expose you to different fields of medicine. And the plastic surgeons were the most interesting. They were the most creative, and they were the most normal. So I did some externship in UT Southwestern, which is where Parkland Hospital is, where Kennedy was taken. And those guys were awesome. And so I went down there and did 5 years of general surgery and then 2 years of plastic surgery in Dallas. And some of the world leaders in plastic surgery, I didn't know it when I went there, were there. They were the guys that in the next 15 years led the national societies and were the great thinkers and doers. And so I got trained by them.
Did you know right away you had an eye for it, or that you were meant to do this?
It feels very good, feels very normal, and I like doing it. I was fine with general surgery. I could do it. I was good at it. And I kind of looked at my wife when I was starting another 2 years of training and went, why am I doing this? And then when I got done, and for the rest of my life, I know why I did it. Because it's just so much more creative, and you're treating happy patients. They're young patients, they're old patients, they're male patients, they're female patients, they're tip of the toe issues to the top of the head issues. So it's a very broad practice, very interesting, and you're making people better.
And how much is art and how much is science? Like with eyes, or some of the more complicated procedures like these bigger lifting or reduction procedures with breasts. What's the art and science there?
Well, you got to know what it's supposed to look like, and once you know what it's supposed to look like, you have to know how to get it there. So you have to know how to treat the tissues and do it safely, and how to do a consultation with a patient to elicit what they'd really like to do, and so you can accurately give them options. And a lot of times you're going to transform everything they're concerned about, and sometimes you go, you know what, you're not ready for this. You don't need this yet, but you can do these things. So what we're really trying to do is take care of the patient, not take care of us. Be a doctor.
How long have you been doing this?
25 years.
Now,
see all this hair I've lost? 25 years.
Are you at a point where you can look at a patient and see that end result?
Absolutely.
I mean, you know where they're going?
Absolutely.
Really?
Absolutely. Otherwise, you shouldn't be doing it. If you don't know where they're going, and if you don't know where they want to go and where they can go, they should be the same place. And if they're not, the patient needs to know.
On a consult, do you ever get excited in your head? You're going, boy, this is going to be good.
This is going to be awesome. Oh, absolutely.
Really?
Oh, absolutely. Well, it's like you're doing a show. Do you ever see somebody and go, wow, this is really going to be great? Same thing. And then you just got to get them to understand how good they can be and to let you do it. We use the analogy all the time of getting on an airplane. You know, when you get on an airplane, you bought a ticket for LA. You don't ask the pilot how much gas you got, what's your heading, what's your altitude, what's weight. You just say, I want to go to LA. Well, the same thing in plastic surgery. We like it when patients come in and say, doctor, I'd like to look better. What are your observations? What do you suggest? And let us do our thing. And then, you know, we'll tailor it to what they can afford, what they're interested in. You know, if something doesn't bother them, why fix it? But we want to know what bothers them and then give them options to fix that. And sometimes we'll say, you know, this may not bother you now, but you ought to consider this additional procedure. It's probably not a mistake to not do it, but it's a mistake to not have thought about doing it, because you can do it all at the same time, one recovery. It's actually less expensive.
What do you want people to know about you? And then we're going to take a quick break.
As
a surgeon, what do you want them to know?
I want them to know that my practice is well-trained, board-certified plastic surgeon that is taking care of them and doing the right choices for them, that we're looking out for them.